Hello everyone, I'm Dr. Kenneth Hodge with Advanced ENT and Allergy. Each week we take your questions and we do our best to answer them. In this episode we're going to discuss the proper way to take care of earwax, some issues with ear pain, and potential addiction to nasal sprays.
What is the best way to clean earwax from my ears?
So earwax is natural. It has lubricating properties and it also fights bacteria and fungi. So some earwax in your ear is actually a good and normal thing. Unfortunately, the genetics of earwax make it so that some people's wax is very thick or very gritty and it can become bound in the ear. And a lot of people want to know what we think about cleaning your ears at home. Unfortunately, as ear, nose, and throat doctors, we only see the people who fail, so our opinion might be a little biased. But there are a few things you can do for yourself. First off, you can put some mineral oil, or some people call it baby oil, in your ear, and that will soften it. You want to try to rinse it with some warm water or a mixture of warm water and peroxide shortly after doing that. And you might have to try that a couple of days in a row. But you have to keep in mind that if that doesn't work, if the water stays in your ear, you might be setting yourself up for an outer ear infection. So if it doesn't work clearly, you want to come on in and see us. We want to avoid using Q-tips in most circumstances, so be cautious with that. Some people get in trouble who use earplugs a lot. It's good for them that they're using earplugs to protect themselves from loud noise, but sometimes it's just a fact of life that you're going to have to get your ears cleared out if you have the wrong makeup of wax and you have to use earplugs a lot. So give that a try.
Can nasal spray be addictive?
You'd be really surprised how often we see people whose main problem with their nose began as a simple cold and a desire to breathe better during that cold. There's probably nothing wrong with trying one of the many over-the-counter decongestant sprays as long as you pay attention to the fine print at the back of the bottle which says, never use this more than 2 times a day for 2 days in a row without talking to your doctor. If you follow that advice, you're probably safe to use these unless you have really bad blood pressure problems. But short-term use of nasal decongestant sprays is not an issue. But once you use them for more than a few days, there is what's called rebound congestion, and you will want to start using that nose spray more and more often. And while there's not a psychological addiction like there are to drugs that work on the mind, there becomes a real physical dependence. And sometimes it can be a real challenge to get people off of that. So my advice to you is use it sparingly, and if you've been on it for more than a week, come and see us. We can help you get rid of it.
My doctor said my ear is clear, but my ear feels stopped up and makes a crackling noise.
You might be surprised, but actually the question about the crackling ear and the headache and the doctor saying the ear looks pretty normal is a really common problem in our office. Actually, I probably see it about 100 times a month. In most cases, when you have a painful ear and the ear exam is normal, it's actually coming down to what we call temporomandibular joint dysfunction. The jaw joint is so close to your ear that if you tend to clench your teeth, you can set up an arthritic problem in that jaw joint and you have no way of distinguishing that from an actual ear problem. A crackling ear is not actually something that's bad for you. In fact, I often tell patients that an ear that never pops is an ear that's likely to get sick. So you don't really notice that you blink your eyes 17,000 times a day, but you would if you had a problem with your eyelid. When you start paying attention to your ear, you'll notice that crackling that's probably going on dozens or even hundreds of times a day just because you're being very mindful of what's going on with your ear. If you don't have a hearing change, an actual difference between one ear and the other, or if your voice doesn't sound like you're talking with your ear covered, you probably don't actually have a problem with an ear infection or ear fluid. So give these things a try, look up temporomandibular joint dysfunction on the internet, and follow some advice there. And if things don't get better, we'd be happy to see you and sort it out. Thanks.